All right. Thank you all for being here for this session of the Roundtable on Environmental Health Sciences, Research, and Medicine. First of all, let me make sure that we thank our sponsors without whom we couldn't have these roundtables. And they include the National Institute of Environmental Health and Sciences, the EPA, the U.S. Geological Survey, Colgate-Palmolive, Shell Oil, ExxonMobil, and the Kresge Foundation. We really are grateful. I think these roundtables in the last couple of years have proved their value in the number of times that people cite what happens here or talk about it. It certainly has proved its value in terms of the quality of our participants. So important ideas are exchanged in these roundtable sessions, and as I said, they would not be possible without the help of our generous sponsors. Thank you. Today's roundtable, bringing public health into urban revitalization, really raises the question, why would a health organization like this roundtable talk about the materials that go into buildings or the way in which cities are organized? And we all know, but in a very vague and general way, that the way people live in cities affects their health. We sort of understand that in terms of their lifestyle and in terms of the products with which they interact in their buildings. But we don't really know that maybe quite as well as we'd like to, and we don't know how to affect that process very well. And today we're going to talk about those two issues. One of the papers in here, and one of the speakers, Greg Katz, talks in his paper about the costs and benefits of green buildings. Well, I think one of the things we have learned in the health area is that if you can't make the economic case, your health case is weakened if you can make it at all. So that it is very important that we not only understand the health benefits, but also how to achieve them and how to argue for them and how to convince decision makers that it's worthwhile improving the urban environment for whatever reasons, be it health or economics. Later today, we're going to have a session that is quite critical, I think, on trying to find ways in which you can measure and determine whether you're actually making progress. And we're going to, that the session on that John Trowbridge, no, that I guess it's Trowbridge is going to handle, is going to deal with that question about the measures and the criteria that we use. Anyway, we're going to get started, and the first session is going to be chaired by our distinguished, and I use that actually accurately this time, our distinguished Vice Chair, Dr. Lynn Goldman, who really is an amazing factor in the health community, in the public health community, and of course a key factor in the roundtable. She has a job as Dean of the George Washington University School of Public Health. But she is, of course, quite aside from that, a renowned epidemiologist, pediatrician, an educator, and a former EPA regulator. So unless we have any additional business, let me ask Lynn to come up here and make some comments and then introduce the first panel.